All right. Good afternoon, everyone. Thank you for joining us today. I am Dr. Ariane Powell, the new Executive Director of the Central Oregon Health Council. As someone who was born and raised right here in Central Oregon, I'm deeply invested in the well-being of our community. After spending the past 15 years away, I'm thrilled to be back home, working alongside passionate individuals like yourselves to advance accessible healthcare across our region. Throughout this webinar, please remain on mute and place your questions in the Q&A section of the webinar. If you have a technology question, please contact Kelly. To start off, we'll have the members of the Health Council team introduce themselves, starting with Michaela.
Good afternoon, everyone. I'm Michaela Arsenault, a program manager at the Central Oregon Health Council.
Good afternoon, friends. Avery Grace, they, she, gender pronouns, Central Oregon Health Council Program Manager. Thank you for being here.
Gwen Jones, I'm also a program manager, so great to see you all today.
Good morning, good afternoon, Miguel Ángel Herrada, program manager at the Central Oregon Health Council.
Hi, everyone. Thanks for joining us. My name is Mary Burns, she, her pronouns, and I'm a program manager with the Health Council.
Hi, everyone. This is Kelly Adams, she, her pronouns. I am the grant platform manager at the Health Council. Welcome.
Good afternoon, everyone. Bradley Garner, Administrative Assistant with the Central Oregon Health Council.
All right, now that you've met the Health Council team, let's talk about why we are here today. Your presence here represents significant commitment, and in many cases, even a sacrifice of your time, your energy, and your resources. It's clear that each one of you recognizes the vital importance of the work that we're undertaking. This dedication speaks volumes about your commitment to the health and well-being of our region, and I'm truly inspired by the collective will to drive meaningful change. Building the Regional Health Improvement Plan is more than just a project. It's a tangible way for each of you to make meaningful action and shape the future of our communities. The RIP is where vision meets strategy, where ideas transform into actionable steps, and where your personal experiences, expertise, and passion can directly influence the health of our community. This is an opportunity to create a lasting impact that will benefit not only the people here today, but also future generations. This orientation marks the beginning of our powerful journey together, and I'm excited to embark on all of it alongside all of you. Together, we'll have the opportunity to make a lasting impact. I look forward to the collaboration and innovation that will emerge from your work. I will pass it on to Mary to talk more about the Regional Health Improvement Plan now.
Thank you, Ari. So let's dive a little bit more into what is the Regional Health Improvement Plan, or what we lovingly refer to as the RIP. Really simply put, it's a shared plan for improving health and well-being in the community, or in our case, the region. The RIP is a document that lays out a vision of where we want our health to be 5 years from now. And it's informed by the results of our regional health assessment that's been conducted over the last couple of years. So it really is a key document in laying out how we want the people who live here to see, feel, experience, have access to the things that help them be healthy. And the key to this, as Ari mentioned, is that it's not just kind of this vision that we define, but it's also the specific strategies or activities that will help us achieve that vision. So by having a document or a guide on how we're going to get there, it allows people and organizations to work together to make progress toward better health for all. So I mentioned that it is a collaborative effort, right? It brings people and organizations together to improve health, because it's much easier for us to make progress when we are all rowing the boat in the same direction. And we're really proud of the fact that we've had over 200 organizations and community members involved throughout this process. So the RIP helps to align our regional focus on what we call collective impact. And if you're not familiar with that term, collective impact is just when different groups come together to solve a really big problem in a coordinated way. Because everyone focuses their unique efforts and resources and knowledge, we can together achieve a lot more than we could ever achieve on our own. Another really important part of the RIP is that it meets the legislative requirements for many of our partners across the region, including our public health departments, our local hospital system, and our CCO. So as you prepare to help build the Regional Health Improvement Plan over the next couple of months, it's really important for you to know who the document is for. Because in creating the RIP, you have to think about all the residents of those places in green on the map. It's not just a plan for people who have a certain type of insurance or no insurance. This plan is for all residents in Crook, Deschutes, Jefferson, and Northern Klamath counties, as well as the individuals who live on the Confederated Tribes of Warm Springs Land, the Cow Creek Band of Umpqua Tribe of Indians, and the Klamath tribes. So now I'm going to hand things over to Michaela, who will explain a little more in detail about how you build a RIP.
Thanks, Mary. So how do we build a RIP? So the Regional Health Improvement Plan has been years in the making with many steps involved. And it all starts with a regional health assessment. And so this is where we collect data and listen to community members to get a snapshot of the health and wellness within Central Oregon. And then based on this data, community members, local organizations, healthcare providers all work together to prioritize key health topics. And then from this prioritized list, our board of directors and our community advisory council selected 6 health topics for the 2025 Regional Health Improvement Plan. And so now we're in the phase that's highlighted in green on your screen. And this is developing a plan for how we as a region will address and improve these health topics. Then later, early in 2025, we'll launch work groups to implement the strategies outlined in the plan that you all will create. So this is an outline of the strategic planning process that will take you through to build the Regional Health Improvement Plan. And so your role is to collaborate and provide the content for the improvement plan using your professional expertise, your lived experience, community input, and data. So we'll start this off by discussing the background. Like, why is this topic important? Why is this an issue? What is the history behind this? Next, we'll look at the current status for that health topic. Like, what is happening now? What does the latest data tell us? What is the community telling us? Then with that information, you as a group will decide on an overarching goal or aim for a region to achieve within the next 5 years. You'll also determine the key measurements that'll tell us whether we're successful. Once your goals and metrics are set, then we'll dive into the factors preventing us from reaching those goals. For instance, why is housing such a significant issue? What are the underlying factors that are contributing to houselessness that we need to address? Then based on that, we'll develop high-level strategies or strategic directions to overcome those barriers. Then based on these strategic directions, you'll identify specific actions that we'll take as a region. And for our community strategic planning, we'll hold 5 in-person sessions. Each will last up to about 3.5 hours. And these meetings are really designed to be highly interactive and collaborative. So that way, or because of that, we won't be able to offer a phone or a video conference option. Also, in response to our community feedback aimed at improving equitable access and involvement across all communities throughout Central Oregon, we're rotating the meeting location for each session. And you can see on the screen the locations for each topic, as well as the week they're starting. Next slide, please. All right. So what does building the RIP look like in action? So over the course of the 5 sessions, you'll probably be wondering, how do we actually put the content within the plan? So throughout this process, you'll provide critical information that will be included within the RIP. And so what you're seeing on the screen is a sample from the last RIP cycle. And while many of the details vary from RIP cycle to RIP cycle, the core components within the plan will remain the same. So if you're following along, the boxes on the screen, again, your role is to identify what the problem looks like in Central Oregon. Then as a group, you'll define the goal for this health topic over the next 5 years and what you aim to achieve as a region. Then you'll identify the metrics and measures of success and what strategies we should take as a region to improve health. Next, I'm going to pass it off to Avery to share with you the 2025 RIP health topics.
Thank you, Michaela. And again, welcome. Some of you we've had the pleasure to have involved in this very extensive process of developing this list of health topics over the last several years, and that will be the focus of the next RIP cycle. And some of you we're lucky to have now. So I would like to share with you the 2025-29 RIP health topics, which are the following. So as you read them, as Mary and Michaela mentioned, the 6 of these were a result of an extensive process over several years, which included a regional health assessment, a series of prioritization processes, as well as a final selection. And I mention that again because all 6 of these topics are very community decided as well as community owned. That being said, of course, there are many potential health topics that are not included here, not explicitly listed. However, these, as well as ones that are not listed, are interdependent and interrelated. The approach, too, that you will get to take will evolve to meet the changing needs of our communities, as well as the changing circumstances, and a great benefit to having you here is you get to help define that is. So I'd like to talk about a number of specific ways in which we'll continue to elevate the participation of our community members. So there are 2 specific instances that the community members who are not traditionally associated with organizations will have an opportunity to weigh in and share their lived experience, which is really critical to this aspect of the process. So the first is community feedback groups. So this will specifically happen in the 2 sections that Michaela mentioned, where we'll look at like the root causes, what are some of the barriers that are really preventing us from getting where we want to go, as well as potential high-level strategic directions. And we'll be specifically looking at the topics of behavioral health and healthcare access. Another opportunity is something called a dyad. So we think of this as an intentional pairing of 2 types of experts. So it could be a community member as well as a topical expert or an organizational member. And that will happen throughout the entirety of the process. And it will happen specifically on the other 4 health topics that are listed there. We're doing this, of course, because our goal is always to build a bigger table, as well as provide more accessible and affirming opportunities for different folks who have lived experience to participate. So having spoken about how community members at large will be able to further weigh in, you might be asking yourself, what might my role be in this? So all of us, of course, have many identities. We're part of a variety of communities, professions, opinions, hopes, ideas, histories, and our intention is to try and include all of that as much as possible. That being said, we also want to seek to individually play our role together in creating the best, the safest, and most productive container for this work to happen amongst a wide group of folks across difference. That being said, I want to talk about some specific roles that we can do at each meeting as a starting place. So my role at each meeting, each of us, if you're here as a part of an organization especially that works on these topics, that's a very, very strong identity considering how much time you spend as part of an org, hourly, weekly, yearly, etc. And we want that. And we want you, as well as all of you, not just your organizational mission, or perspective. We want that as well, but we want to bring it at a community level. We want to be more than just specific organizational or professional identities so that we can serve all of our communities. The second thing to consider is sharing knowledge from your lived experience as well as professional and educational lives. So each of us has invaluable and unique knowledge and wisdoms. And if we share from our lived experience as well as these other roles, we will offer tools to be able to better value those the same. So tools, guidance, as well as other facilitation methods will be used to remind and encourage each of us to be able to deeply value the lived experience and types of knowledge that we and other individuals bring. And the last thing I want to mention is we're here to work for the entire community, all of our communities. So not in spite of our difference, but because of our differences in knowledge, we are stronger as peers as part of this process. One tool that I'd like to offer is also what we call the 2025 RIP guidelines. So as you read them here, these guidelines were created as part of this co-creative process with our steering groups and other community participants. And the guidelines are a practice of principles that we're offering because it can be incredibly difficult for us to not value more our personal experiences and viewpoints over others. As shown here, as well as in the orientation materials, these guidelines specifically encourage a number of different things. So examples are, we're focusing on reducing health disparities. We're focusing across the region. We're working to achieve equity, social justice, equal distribution of resources and power, centering humanity, having an ecosystem mindset, etc. So these are principles, they're guidelines and aspirations. They'll be included in your orientation materials. And we'd like to offer specific tools to support us in making these principles a reality. So here are some examples of some of the tools that can support us in aspiring towards those guidelines. So the first is group agreements and meeting practices. Each of us know that how we relate to each other more than anything determines the level of trust or cohesion, the joy, the productivity of the processes or the work of a group of people. Soon you will have in your email account following the live stream webinar some tools that we will practice continuously through the RIP building meetings. So for instance, guiding naming and addressing the harm of microaggressions. That's one example of small, often unintentional ways that we might harm others in a group that are different from us. Some other examples, as we mentioned, was valuing and seeing the same others' experience as well as our own. And also included will be a guide for putting on a shared pair of equity glasses, if you will. So that will help us go through the work with a shared lens that we're looking through. So that is, it can be very heavy, it can be heady. There will be games, there will be other ways to practice so that it's less intimidating and more accessible. So now we've talked about some tools that might support us in our shared intentions during these meetings. You might also be asking, can I get help or support to participate? And of course, we're committed to offering a number of specific supports that you may have in place to show up to each meeting. In other words, these are supports that are available to make it easy and accessible as possible. So let's look at some of these specific supports that we've arranged. The first is language support. So we have the ability to have interpreters present as well as materials translated for the process if requested. Please do email staff at the email address listed at the end of the webinar to specifically request this in advance. Through that contact information, you can share with us which options you need and which languages you'd like that interpreted into. We're also happy to make accommodations to those who have differences in hearing ability to be able to participate more easily. which can range from ASL to closed captioning and other accessibility resources, please do let us know how we can arrange it ahead of time. And of course, another critical and relevant support is financial support. So as Ari mentioned at the beginning, we acknowledge that this is a huge investment of time, money, resources, gas, childcare, and more. And we deeply appreciate your willingness and commitment, and we want to honor that. And we appreciate that your sacrifice is making this process sacred. So what financial support can look like, the amount will depend on the role in which you're playing. And by that, I mean, if you're participating as a person with or without organizational affiliation, or if you're coming as part of an organization with a larger or smaller operating budget. For community members unaffiliated with organizations or people, we can provide a $100 stipend per meeting to help relieve some of the costs of participation. It's available for all types of meetings that you might participate in. So they could be the build meetings, they could be community feedback sessions, etc. $100 per meeting. But do keep in mind that accepting the stipend, it might impact your income eligibility for benefits like OHP and or your taxes. So any amount received of $600 or more is required to be reported to the IRS's income. And if you have any confusion about that, please do contact staff, and we're happy to navigate that with you and answer any questions. By contrast, for our participations who are joining from a smaller organization, we define a smaller organization in this context as one with an annual operating budget of less than $1 million. So for these small organizations, we can provide to the organization one $500 scholarship per health topic you participate in. So for example, if your organization has one employee in transportation, one employee attending nutrition, physical activity, and weight status, your organization could be eligible for a $1,000 scholarship based on those two individuals' participation in two different health topics. That being said, to receive this, an organizational representative needs to attend all 5 meetings on the health topic to receive the scholarship. And again, please do reach out to staff directly at the contact information provided if you would like to discuss this, any confusion about you or your organization's eligibility. And now Mary will also share more details about what transportation supports are available for RIP Build participants.
Okay, thank you, Avery. Another challenge that can come up when you're trying to participate in a meeting or a process such as this one is transportation. So there are a few different ways that we can help support physically getting you to the meeting. The first one of those is mileage reimbursement. If you are not already receiving mileage reimbursement from someone else like your employer, we can certainly provide this for you. If you need a ride to or from any of the meetings, feel free to arrange that for yourself via rideshare, taxi, public transit, anything you'd like, and then provide us with the receipt and we can offer reimbursement for that transportation. The one that we do ask for you to contact us in advance for is if you need wheelchair transportation or paratransit services. We are happy to arrange that with you, and we will work together with you to set up your rides to and from the meetings. We also have the opportunity to offer childcare support for you, and this can come in 2 different ways. If you arrange your own childcare to be done during the meetings, we can support you by reimbursing at a rate of $20 per hour. And we can get into, after the orientation, all of the specific processes, but as long as you provide us with a receipt for childcare during those times, we can reimburse you at $20 per hour. You also have the option of on-site childcare to be provided. This is something that, again, we need to know in advance. So please make sure you let us know the number of children, their ages, and which meetings you will need that childcare for using the contact information at the end of our presentation. other options that are available to you. Of course, meals, there will be a catered meal provided to everyone at every meeting that you attend for RIP Build. Additionally, if you have to travel 80 miles or longer one way to attend any of these meetings, please reach out to us so that we can help support you in arranging an overnight stay that we would either reimburse or arrange for you. We also recognize that the supports you need right now may not be the supports you need 3 weeks from now or 6 weeks from now. So if things change across this process, please know that we are open to that. Just stay in contact with us. And if you need something different down the road, we're happy to work together with you to arrange that. So what does the Central Oregon Health Council have to do with all of this? Our purpose as we were created is to create a healthier Central Oregon. We work together in a lot of different ways to build an equitable and integrated health ecosystem for the entire region. And also, when we were created underneath the Senate bill, Oregon Senate Bill 648, we were tasked with doing a handful of things. And 2 of those very specific things were to conduct the regional health assessment and the regional health improvement plan. And you'll note on that slide there that it is called out that these documents are meant to reflect and serve the entire population of the region. So when we show up in meetings or when we conduct events such as this one, our goal is to bring people together to work on the community's health needs. We, as facilitators, provide structure and guidance for the meetings, this one or any of your RIP Build meetings coming in the future. One of our main goals, the thing that we are always keeping top of mind as staff, is how can we help you as the participants prioritize health equity and this big task of reducing health disparities in every decision that you make. We also really want to support creativity and all of the best practices that you have to offer as we go through this process together. And then there's always this little thing in the back of our mind of making sure that as we go through this, we are checking all the boxes necessary to meet every legislative requirement, and we are meeting it, we are conducting them at high quality. So now I'm going to hand things back to Michaela, who will wrap us up.
All right, so some of you may be wondering, where does the money come in? You also might be curious about how the rules of the funding and limitations could affect our strategies this time around. So for those of you that are new, in each RIP cycle, the Health Council provides the work groups with funds to invest in projects aimed at achieving their goals and metrics of success. However, as shown on the screen on the right-hand side, these funds come with strict restrictions on how they can be used. So to help clarify why these funds come with rules, look on the left of the diagram, and the funds that are available for the work groups to help implement the plan ultimately come from the state and federal government. And these are Medicaid funds. So both the state and the federal government require us to keep these funds separate from those that are used for Medicaid covered services, such as paying for a doctor's visit. We also have rigorous reporting processes to demonstrate that we adhere to these rules and have been responsible stewards of these dollars. And the main purpose of these funds are to improve community health. So this can be challenging, especially when certain health topics may require things like clinical strategies that we can't fund. And this is where it's important to remember that the Regional Health Improvement Plan is a community plan, and that funding is just one tool that we have to improve health. We can do things like collaboration, coordination, systems change. We also have other groups in the communities doing the work that can contribute to the overall plan. So not all the work under the Regional Health Improvement Plan has to be done within the RIP work groups. or even the umbrella of the Health Council. All right, and with that, that concludes our presentation. We want to thank you for your time and commitment to improving community health. We know that your participation in the RIP building sessions is a significant ask, and we truly appreciate your dedication. If you need to contact us, please reach out at info@cohealthcouncil.org or call us at 541-306-3523. And for those of you joining us live, we have time for questions. So please use the Q&A feature on your device and staff will answer. Glad you're here.
All right, I can start us off with one question that we have right now, and that is, are any of these RIP funding restrictions new for this RIP cycle? Gwen, do you want to take that one? Or Kelly?
Yeah, I'm happy to. So many of them started in the middle of the last RIP cycle. The ones that you see here continue into the new RIP cycle. And we anticipate that new ones may come in the next 5 years as well. So you'll see some new, some familiar, some in between.
Those are all the questions we have right now. If you folks have things that they still want answered, if you hover your mouse over the bottom of your Zoom screen, it should open up the Q&A option for you. I have one question that's coming in the chat. Can we get these slides so I can present it to my boss? Absolutely. Christina, can you send us an email at the info account and we'll make sure to get those out to you? Thank you. All right. How many people are currently signed up to participate in each topic, and is each community represented? I have spent a lot of time in our RSVP sheet, so I am happy to take that one. As we expected, there are certain topics that have a lot of participation and ones that have a little bit less. Our mental or behavioral health topic has a really wide range of representation, and a lot of folks signed up to participate in it. Looks like 52 individuals are currently signed up for that one. For access and quality, that one is also really well represented and seems like a well-rounded group of folks with 35. Then from there, with alcohol, tobacco, and drugs, nutrition, physical status and weight, and transportation, the numbers get smaller and lean a little more heavily towards specialist versus community members. Housing, we are at 29 currently. So the second part of your question with, is the community represented? Full transparency, it's hard for me to say because what I see right now are names and emails on a spreadsheet, and that doesn't speak to folks' lived experience or the things that they bring to the table. But what I will tell you is overwhelmingly, it is a lot of new names and names from outside of organizational partners. And we are really excited about that prospect of bringing so many community members into this process. Okay, next question. To be clear, only Medicaid funding is part of the RIP. Michaela, do you want to go ahead with that one?
Yes, so the RIP funding from the Health Council, those are all Medicaid dollars. However, if the group comes up with different strategies, our community partner organizations can apply for external grants to help implement some of the strategies, but the funding that comes from the Health Council are Medicaid dollars.
Let us know if we need any follow-up on that question. We have another one. Will separate invitations be sent out for the community feedback sessions so we may pass those along to our communities? Miguel, I'll hand that one over to you.
Yes, I was writing the answer, but thank you for giving me the opportunity. So we are focusing particularly for these invitations on the people who participated on the regional health assessment focus groups, and also on the people who wanted to be part of the RIP during our feedback sessions. But so it's not everybody who will receive this invitation, but if you want to receive the invite and all the information related to that, we will be happy to share with you, and then you share it with whoever you want to invite.
Thank you, Miguel. Avery, I'm going to hand this next one off to you. Why no meetings in Bend?
So an appropriate growing edge and critique of some of our RIP building and other processes and programming is that they've often been very Deschutes County centric, even Bend centric. Of course, there are many different organizations, projects, etc., that seek funding through the RIP and through the work groups that are in Deschutes County, both urban Deschutes and rural Deschutes. But we also recognize that historically, this process gets to do a better job at being more intentional and inclusive of communities that are outside of Bend specifically. So it's not so much that we don't want to have a meeting in Bend or anything, but this is an intentional set of choices so that we could make it as easy as possible, both for folks who traditionally haven't been as involved to be involved this time around, but also because for each build meeting, folks might be coming, say, from Madras or Warm Springs. So we want to create opportunities so that there might be opportunities for those who are farther out to not have to travel quite as much for every single build meeting. So it's an intentional practice. I know that it might be a little new. It might be a new challenge or potentially even barrier for folks who are used to having things in Bend or Redmond, et cetera. But this is why we have things like our transportation supports as well as others. If that doesn't answer your question, I'm also happy to address any other details. Hope that was helpful.
Thank you, Avery. Miguel, it looks like you're answering one of them already, so I'm going to go to the second one. Are new players to this process that you are excited to welcome? Any new players to this process that you are excited to welcome to the conversation? I'm excited to hear more about outside of the box perspective and inclusive efforts you are discussing. Love that the meetings are being held outside of Bend. I think that really shows action in this commitment. Gwen, can I hand that one off to you?
Surely. We are really excited to have a strong combination of folks with a broader variety of experience across many sectors for any of these health topics. And I think that's what brings us excitement, and is that we'll be able to build in, tried and true, as well as perhaps more unique or nuanced approaches for different folks, especially those who have been subject to health disparities. And we're really excited to try it in a new and different way with you, and are very grateful for your willingness to try it and go into some new and less familiar territory together. So thank you for your willingness to do that.
Thanks, Gwen. I'm going to give a brief pause here. We're out of questions in the Q&A, but if you have lingering things that you would like more information on, please drop them in there, and we'll use this time while we have it. All right. We have a message from someone in the chat to share. Just a quick plug, being part of the last RIP work group was an eye-opening and positive experience. That's really great to hear. Okay, if no other comments or questions, we'll go ahead and wrap up, but please know that this is not the absolute deadline for any questions you have. You can reach out to us anytime at the email that Gwen just shared in the chat or through connections you have with any of us from previous experience. We want to make this as easy as possible, and we thank you so much for coming together for this webinar and learning a little bit more about the process. I just got one more in the chat. Thomas, I will follow up with you directly. And if anyone else does not have the locations and times for their meetings, please send us an email and let us know. You should have had that information already. So we want to make sure you have everything you need to make your plans.
I can share the full schedule for everybody to connect. Let me put that on the chat. So I'm sharing on the answer the full schedule of all the meetings for all the groups. So you can click there. Oh, wait. Maybe it's not visible. Let me get that link again. Here on the chat. So if you click on the link I just shared in the chat, you will be directed to the entire list of all the meetings in all the places. It was included on the original email, but here you have it again.
Thank you, Miguel. All right, thank you so much, everyone. We'll hang on for a couple minutes if any other questions come on, but otherwise you can feel free to leave the meeting.